Hello, this is Dr. Scott Harrington coming to you live from my virtual doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor virtually from most U.S. states. If you live in Florida, I'm now open in Pinellas Park, Florida on Fridays. Come see me in person or online, not just as a one-time consultation, but as your primary care doctor, someone who gets to know you, someone who can be your health advocate, someone who can see you who is plant-based doctor. Because I'm a licensed doctor in most US states, even if you moved, you don't have to change doctors. If you're a vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, you are still welcome to be my patient. But beware, diet and exercise and lifestyle changes will always be my first recommendation. My goal for you is to take control of your health, and through the power of a healthy lifestyle, we will work together to heal your chronic conditions and help you get off chronic medications. Remember that this content is for educational and entertainment purposes only. This video is not intended to take place of your own doctor's advice. Okay, we are streaming on multiple platforms and ready to take your questions. Okay, let me get over here into the comments section. Okay, so we've got several folks on Facebook right now. Good deal. So there was a little hiatus, a little family vacations and stuff like that. So I'm glad to be back, and everything is looking good for a continual weekly lives. So that's very good. Thank you for everyone who's returning today. I really appreciate it. So, wow, lots of things going on in the medical community. Coronavirus is increasing the rates. Delta variant is coming back with a vengeance. And so I urge all my patients and all the folks listening today to make sure that you're social distancing, that you're wearing a mask, and going back to prior sort of concern about the coronavirus. We want to hit this pandemic. We want to nip it in the bud, and we don't want to let it rage through our country. So if you haven't been vaccinated, get vaccinated. Do it for yourself. Do it for your family. Do it for your country. It's the patriotic thing to do. So I've been vaccinated, and that's what I recommend to my patients. So there was a study in Massachusetts that came out. It was about a week ago, and it was suggesting that you can have the virus and pass it on even if you've been vaccinated. Certainly, vaccination helps you reduce severe symptoms. And the fatalities among people who are vaccinated are very, very low. But for people who are not vaccinated, the fatality rate seems to be increasing somewhat. So it's very important that we stay healthy, that we socially distance, that we wear masks, and that sort of thing. I don't know if that needs to be the entire topic today, but I just wanted to open with that because we're fighting a pandemic, and so don't become complacent. Keep going. Keep up the good fight. Okay. If you have any comments today, just throw it in the comments section or questions. Let me know. If you have very, very specific questions about your health, then please send me a direct message or reach out to me at my office. Our office number, I'll put it in the comments section here. Vegan Primary Care Office number. Reach out if you need to be contacted. Okay. Whoa. 727-222-3036. That's the number. Okay. Well, let's go ahead. We've got someone on Periscope. We've got some folks on Facebook, several folks on Facebook. I am a family doctor, and the American Family Physician magazine, they have new evidence that's come out. If you take aspirin for the primary prevention for heart attack and stroke and colon cancer, they recommend against it because of the higher risks of bleeding. If you get in an accident, aspirin has been a miracle drug a miracle drug for folks who have already had a history of heart attacks and ischemic strokes, clots. So new information, though. People who are trying to prevent a heart attack who have never actually had a heart attack or an ischemic stroke or colon cancer, they're recommending against it because that's making you higher risk for bleeding. Now, I've been in the military, and we've known about these risks for a long time because in the military, you get in the risk for in the way of combat operations and that sort of thing. And so you can have a traumatic experience, some sort of trauma or injury that you can bleed out. So we definitely don't recommend it for soldiers, especially unless they've had a history of heart attack or ischemic stroke or something like that. In this day and age, this modern world of having a history of people on cholesterol medications and people who have colon cancer screening, these kind of things have overall reduced some of the rates of people having heart attacks, and it's kind of outstripping the benefit of primary prevention with aspirin. So I don't know, maybe to some of the younger folks that might be kind of a boring topic, but it's a very big deal in the medical community. Okay, all right. I'm gonna try a little switcheroo here on. Let's see. I'm gonna try a little switcheroo. I'm gonna try to share my screen. Share screen. Share screen. Okay. Share screen. Okay. I'm going to try to share it. Let's do this. Okay. Kind of going backwards a little bit here. Too far. That was what we did last week. Okay, here we go. Here we are. If you're just coming in, and if you don't know that Dr. Harrington, here I am. I have lots of medical licenses throughout the United States. Some of the blue states are temporary for COVID, have allowed me licenses. But just to let you know that if you're in any of those other states and you want to see me online, I can see you. One of the things I do for my patients is use this accountability app called the 8 Food Logging app. This is a lot of fun. We get to share our meals, this food logging. It's a social app. It's not on Facebook or anything, but anybody that you share your code with, you can see the food log that they're doing. It's a lot of fun. Also, on Tuesdays at 7 p.m., I do the Get to Your Goal weight loss meeting. It's a free meeting that my patients can get involved with. And what it does is we talk about what went right and what went wrong, pearls and pitfalls for the weight loss goals for the week. It's been great. It's been very supportive, and my patients love it. Another thing we do is I have Taito Care, an account with Taito Care, where people can buy this device if they're interested in sending me exam findings for the ears or the throat or the heart and lungs. This is a great device that people can use to get more of an in-person type visit virtually in the comfort of your own home. I love it. Taito Care. If you want to get involved with Taito Care, you want the device, you can put in the $75 off coupon code with the coupon code VPC, Vegan Primary Care. Okay, little tip today. Sometimes when you have maybe an unhealthy habit, or you're such as, let's say, smoking or kind of alcohol drinking and stuff like that, or just eating kind of food that's not healthy for you. Sometimes it takes, you can wait until you have a major medical event like a heart attack or something like that, or you can try to get motivated now and try to prevent these things from happening. And so it's to try to finding the why you want to be healthy. And here's a little acronym, HELPS. So obviously for health, you want to be healthy so that you don't come down with cancer or, heart attacks. But think about E, energy. You want to feel good today. You want to be more energetic and vital and being able to do things with exercise and freedom. that kind of thing. Weight can drag you down and make you feel like you're claustrophobic, almost like you can't do the things that you enjoy doing. L is for your loved ones. Stay healthy for the ones you love. Stay healthy because you want to live a long life. You want to be there for your family, and you want to be supportive of them. And you don't want to, you want to be a role model too, a role model to them, a very healthy person, because you want them to be healthy as well. Okay, so productivity. Having a healthy diet is kind of like health insurance. And think about the costs of having to spend more money on healthcare and medications and this sort of thing. And it also makes you very productive, and helps in your job, helps you with all those things that we described, energy. And the last one is happiness. Health is truly wealth. Health is wealth. And it's harder to feel happy when you are in pain because of knee pain, because of weight, or injury. You want to be able to bounce back from injury the faster you can, good blood flow, good health, these kind of things. So this is a little acronym for you: HELPS, health, energy, loved ones, productivity, and smiles, as a way to help you think about what are some good reasons to be healthy. Okay, let's stop the sharing and go back. Okay. All right, so I think we're back. This looks like we've got the screen just right. Let's see. Sharing your share. I'm going to stop that. All right, we are back. Okay. Can you still see me? All right. Post if you can still see me, and post a question for today, and I'll get your question answered. All right. Seeing that the folks are still on. All right. Today we have folks from Facebook and Periscope and Twitch. We're all over. We're worldwide, online. Okay, so recently I had a question about hypnotherapy. Some patients are interested in using hypnotherapy, which is used for smoking and studied for smoking in the past. And let's go over it. The evidence for hypnotherapy is mixed reviews for smoking. What's interesting is when a lot of the studies were done, it was kind of some up, some down, some up, some down. But a meta-analysis, the analysis that's taken all the studies for smoking and hypnotherapy, it overall shows a positive trend. So basically, hypnotherapy is effective for smoking, but it's not the most effective strategy. However, I say, if it can't hurt. It can't hurt. The only thing that could hurt is your pocketbook, your wallet, But the idea of the power of suggestion, and even the power when you're studying something, when you're looking at something, kind of has a positive or placebo effect. If it's a placebo effect, who cares? As long as it's helping you. So one of the things about hypnotherapy, I almost suggest that the idea of watching health documentaries is almost like hypnotherapy, keeping the idea of a healthy behavior in the forefront of your mind. So getting on Netflix and watching, movies like The Game Changers. The Game Changers is a great movie to help keep health in the front of your mind, the plant-based diet. And then all the ones like Seaspiracy and Cowspiracy, the reasons why you want to do it for a healthy planet and to prevent animal suffering. Those are great documentaries. So in terms of hypnotherapy for health and eating right, there's so many daily decisions that go on throughout, and you're confronted with the idea of, should I eat this unhealthy food or this healthy food, that I assume that hypnotherapy is going to be a positive benefit for patients. All right. We've got Shirley coming in from Ohio. Hi, Shirley Narducci. All right. Hello from Florida. All right. We've got Susan Vasquez says that she can see me. Kimberly, I can see you too. Kimberly Romano. All right. Okay. So we have Shirley. Doc, what can you do for hair loss from lymphedema? Okay. Well, and I see that Deanne has also got a question about hair loss. Okay, so let's go over some hair loss tips. So when we're talking about hair loss because of lymphedema or hair loss from peripheral vascular disease, these kind of changes with the blood flow and the skin, then it is very difficult to deal with with hair loss related to those kind of things. For instance, with peripheral vascular changes is in the leg, that means that you're having decreased blood flow to the leg, and over time you have kind of thinning of the hair on the leg, and then eventually you kind of have no hair on the leg. This is typically not the same problem that causes hair loss on your head. And lymphedema can create changes in the skin and vasculature and blood flow that can have kind of a similar effect. So it's very difficult. Now there are for females losing hair, and especially if it's in sort of the classic male pattern baldness or androgenic pattern, like for me, I'm kind of, it's starting to creep back here. It's just what happens. Reasonable to go to your doctor and talk about testing for things for male hormone, androgens, testosterone type things. If there's a hormonal aspect that could be one diagnosed and try to figure out what's the deal, what's happening. Weight loss, if you're overweight, can be helpful in preventing further androgenic changes. And so that's something that you should talk to your doctor about. There are medications, but certainly I always recommend diet first, weight loss first. What I have found is when I really focus on eating right, I get my fingernails, they seem to grow a lot, and my hair just grows really fast. And it's actually something that my family members will joke around, because in the Army, I was always getting my hair, like buzzed, like in a flat top, every week. And, every week and a half, it would be kind of back with a vengeance. And so the concept is when you're eating a whole food plant-based diet with lots of greens, beans, and grains, you're getting lots of micronutrients, and it makes your nails and your hair kind of thicker. And certainly there's, if you feel like you're not eating a variety of foods there, you could consider a multivitamin. And there's some of the things like biotin and, zinc and different things that can help. But mainly that's what I recommend, eating a diet that's high in fruits and vegetables and beans, greens, and grains. These are they're loaded with nutrients, and certainly that should cover it. All right. All right, here we go. Okay, so Deanne's describing some more about her specific issues. Shirley is posting. Yes, so the question is from Shirley, is a plant-based diet better for lymphedema? So we don't have a specific study to support plant-based diet for lymphedema. Lymphedema can occur after people have lymph node removal, and you can have an area that has poor lymph flow, and it can develop swelling and sort of hot and red and swollen, and a different kind of tissue texture change to the area. So lymphedema responds well to positioning. So if you've got a cut on your arm, you raise it above your heart, you have less flow there and that sort of thing. So it's kind of similar with lymphedema. So gravity can play an effect, or you can wrap the area. A small bit of compression can decrease lymphedema. So if it's in the legs, for instance, you can wear compression stockings and that sort of thing. So, but the question was, is a plant-based diet best for lymphedema? And all I can say is that a plant-based diet works for hypertension, for diabetes, for cancer prevention, for these kind of things. And it's the best diet that I know for all these medical things. And so I assume that is the best diet for lymphedema, but I don't have the evidence to back that up. But certainly those other things are what you're going to want to try, sort of wrapping and positioning in a way, or wearing compression stockings in the legs, that kind of thing. Okay, thanks for your questions. Continue with asking me the questions. So let's put more questions on and we'll see how we can do, if we can get you answered. Okay, Susan says she's got to go. Her lunch break is over. Okay, so we've got a question here. Kimberly Romero asks, in what ways can a plant-based diet help with sleep apnea? Okay, I'm glad you asked about sleep apnea, Kimberly, because sleep apnea is a problem. It is a real epidemic in our country. And the way sleep apnea works is people have loud snoring at night, and sometimes they stop breathing. So the way this works, I like to describe it as a James Bond movie. In James Bond, there's a guy, and he's like, saying, "Hey, who do you work for?" And they put their face underwater, and then they can't breathe, and they pull up and they gasp, and then, "Who do you work for?" I mean, that's kind of a bad joke, but the concept is that people who have really bad sleep apnea, I use that analogy to describe the stressful situation that's happening in the body. So the diaphragm works by itself. It can just keep you breathing at night. And in order to do a full breath, you have to use the muscles around your rib cage. And this is controlled by your voluntary control, by your awake mind, having the big breath. The diaphragm can go on autopilot and can do this at night while you're sleeping. However, the diaphragm, if you have a lot of snoring, a lot of tissue, or the way that the chin is positioned, it can block the airway at night, and you'll hear loud snoring, and then the diaphragm will keep fighting against it, and eventually it will stop because it can't fight against it any longer. So when you're in this deep sleep and you stop breathing, the stress kind of goes up and up and up until it wakes you up enough that you use a voluntary breath, and it helps you calm back down and you fall back asleep, and the cycle starts over again. So this is people who wake up with headaches, they wake up, they don't feel rested, and they start to fall asleep through the day. And this is a big problem because there's no cure for it other than a CPAP machine that helps to force the mouth open and helps you breathe. Surgeries for this treatment are sort of effective only in specific situations where maybe your tonsils are causing it. They're really large. There's they call it the UPPP. It's a surgery that helps to open up the airway, but it's only 50% effective. So the mainstay of treatment is the CPAP machine. I can order a sleep study for people that they can do at home. And then if we find that you have sleep apnea with this home recorder, then we can get you set up with a CPAP machine. So long answer for here. And here's the question. Does a plant-based diet help with sleep apnea? I'm going to say the answer is yes and no. The no part is that it can't change the mechanics of your airway by itself there. But a plant-based diet, if you get off of dairy, it can decrease nasal congestion related to allergies. So that can be a specific benefit. It decreases mucus and that sort of thing in the throat and airway. It can decrease asthma and that sort of thing. And most importantly, the biggest risk factor for sleep apnea is weight. And so the yes part is those allergies and the weight and that sort of thing, getting it down. So if you have sleep apnea, you definitely want to be on a plant-based diet, but you also definitely want to have the CPAP machine until if your weight goes down and then you don't need it anymore. But even some folks who have very low body weight because of the way the chin is or the tonsils and stuff like that can have sleep apnea. Kids get it too. That's one of the reasons why kids sometimes get their tonsils removed and that kind of thing. So that hopefully gives you an understanding of that. And I definitely recommend a plant-based diet. All right, Tanya. Okay. Tanya Mint, hello. Thank you for advice. What can we do to help a person with misophobia? Misophobia. Well, misophobia. I'm Googling it because I am not smart enough to know what misophobia is. Okay, looks like misophobia is a common disorder characterized by the experience of strong negative emotions of anger and anxiety in response to everyday sounds by other people eating, drinking, and breathing. Okay. Well, this certain phobias and anxieties can be really, really problematic. So I've never advised someone with this specific phobia, and I'm not an island. I do solicit the advice from medical specialists and stuff like psychiatrists and psychologists for certain sort of mental health conditions. However, for anxieties in general, my number one recommendation is exercise. One of my sort of sayings is diet is the building blocks for your body and exercise is for mental health because it really clears your mind. It's hard to feel anxious and angry after exercise, and endorphins are released, these kind of pleasure chemicals that kind of puts you at ease. And so I'm not familiar with misophobia in terms of how to best advise you. So I would recommend, mental health specialist if that's something that's really affecting your life negatively. We all have depression. We all have a little anxiety. And when you start naming these different things, anger from X, Y, or Z, fear of heights, stuff like this. As a family doctor, I'm constantly telling people, oh, that's normal. Oh, that's normal. Depression, anxiety, mild, that's normal. It's when these things start to become a problem for you. If you have, if you're washing your hands so many times a day that, it's starting to get where you won't leave your house, that's a problem. And that's something that you should seek help for. But being, cleanliness is a good thing, and washing your hands during a pandemic is totally normal. It's only a problem when the behavior becomes too strong and too altering the other parts of your life negatively. Okay, Kimberly says, can you help people out in New Mexico? And the answer is yes. Yes, I have a license in New Mexico. You can simply go to Vegan Primary Care and click book appointment, and we can get you set up with an appointment. So, all right. I have hit my time. I've hit my time. So I think we'll end the session unless we have other questions. If you want to, go ahead and quickly post a question. We'll knock out one or two more short questions. If you have one, let me know. Put it in the comments, and we'll go from there. So general announcements is that I am going to be tonight. I'm going to be talking at Green Culture Cafe in Trinity, Florida. It's near Newport Richey. I do that the first Wednesday of the month at 6 p.m. So I'm there. If you want to eat with a doctor, you can come out at the Green Culture Cafe, and we can see you there. Okay. All right, Shirley. Thank you. All right, we've got Patty. Patty says, do you take TRICARE? I do. I have TRICARE East, which is most of the eastern part of the country. So if you're under the TRICARE East in a state that accepts TRICARE East, then I can see you. Okay. Medicare, we've got a question here. Do you take Medicare and supplement out in California? So I do take Medicare. A lot of times it is state by state, but we can try to query Medicare. If my Florida Medicare, basically my Florida Medicare license, if it will work in California, I'm licensed in California, and a lot of times it can transition, it can work across states for Medicare. All right. Yes, Patty, these are virtual appointments. Patty says, are they virtual appointments? Yes, they're virtual. Unless you live in Florida, where you can come see me in Pinellas Park, the visits are virtual. All right. Thank you so much, folks, for listening. If you have any other questions, go ahead and put them into the comment section. If you happen to arrive when it's not a live video, I'll still answer your questions as needed. And we'll see you next week. Take care.